Okay, well, with that said, I'll go ahead and get started. Welcome everyone to the HICE California Assembly Bill, AB 3275. This is a presentation provided by the lead and co-leads of the HICE work group for AB 3275. I'll go ahead and introduce myself, and then my other co-leads will go ahead and introduce themselves before they're actually doing their presentation. So my name is Julissa Leon, and I actually work for Sutter Health. I've been with this organization for about 13 years, and I oversee the claims operations and recovery departments at Sutter Health. And I'm happy to be here to talk about this beautiful assembly bill that was brought upon us with an effective date of 1/1/26. Okay, so a quick overview introduction regarding the Assembly Bill. So the Assembly Bill 3275 introduces updates to California claims reimbursement standards. The effective date, as I mentioned, did become effective January 1st of 2026. Things to consider regarding this Assembly Bill was to strengthen consumers' protections, improve payment timeliness, and of course, increase timeliness in claims adjudication to ensure that claims are being processed according to the new regulation, of which I will get into in a little bit. The purpose of this training is to help clarify the new statutory requirements in regards to reimbursement, interest accruals, penalties, and specifically we'll be touching on the provider dispute resolution process. Also addressing or helping with operational challenges and any compliance risks that can come based on not meeting the new timeliness of 30 calendar days for AB 3275, and of course help with best practices to ensure that accurate and timely claims processing is occurring for each and every one of you in your organization. Our goal is that by the end of this training, you will better understand the key provisions around 3275 and the potential impacts that it can happen in your operations. Also being able to identify and or resolve any issues that can come into play regarding either delayed payments, contested claims, or even denied claims. And then the operational strategies in order for us to remain compliant around the 30-day reimbursement rule. And as I mentioned, the interest accrual, penalties, and the provider dispute resolution process. So part of the 3275, there was an APL, which is 25007 regarding the claims reimbursement changes. Prior, it was 1371, and now it's 1371. I'm sorry, 1371.35. So some key points regarding this, the scope, this applies to the commercial and Medicare plans. And then the effective date, as I mentioned, is any claims or disputes received on or after January 1st of 26. Talking about payment timeliness, all claims must be reimbursed within 30 calendar days of receipt. And as far as your denials or contested claims, written notification also the claims also need to be processed within 30 calendar days of receipt. As far as interest payments, there has been some changes. Key things or key points to remember is there's a 15% annual interest that applies to claims and disputes that are not paid within the 30 calendar days. Interest must be automatically included, so that means you will need to update your systems accordingly if you have not yet done so. Hopefully by now you have. And there's one key thing to remember is there's no separate calculation for ER claims as there used to be before, prior to this new reg. And continuing on, as far as interest and penalties, I think one of the things to remember is that there's a $15 or 10% accrued interest, whichever is greater. And the rule technically applies as follows, that if the 10% rule applies when interest actually exceeds $150, is probably the better way to understand it. As far as acknowledging the rules, the contested claims, my apologies. The contested claims, they must be clear, detailed, and ensure that what is being sent needs to be reconsidered. And then as far as denial of claims, making sure that the denied claims are also denied within the 30 calendar days. And for the provider dispute timeliness, that pretty much remains unchanged, meaning that those provider disputes can continue to be processed within 45 working days. However, the biggest change here is that the interest will start applying on day 31st. Many organizations are taking the lead on processing all claims under this regulation, especially for PDRs under 30 days. I know that Sutter is definitely doing that, and we've been quite successful in doing that as well. As far as this slide here, I want to go ahead and just, I'm not going to go over all of them, but we did outline a couple of topics just to mention. For example, acknowledgements, there's no change in that. The 15 business days to acknowledge claims will, remains unchanged. However, you can see that there has been a lot of changes in terms of your 45 days to 30 days, 45 business days to 30 calendar days, interest has changed, and then so forth. But this is a good slide to actually reference back to if there's any information that is required. So with that said, I'm going to go ahead and pass it to Leslie, and she can introduce herself.
Hi, I am Leslie Riddick, and I also work for Sutter Health, and I am the Claims Compliance Supervisor. So I think most of you know me, as we are all, most of us are on the HICE standardization call. So a lot of what Lisa said, I will probably be reiterating too, because I think what we want to do is kind of really drill this in, even though it's been implemented since January, but we just really want to ensure everybody knows what the requirements are. So this slide is the claims reimbursement timeliness. So as Julissa said, claims received, which is very important, on or after 1/1/26 are under the California Health and Safety Code sections, and we must, for paid claims, reimburse within 30 calendar days from the date of receipt. Contested and denied claims, which is also provider and member denied claims, must be the written notice must be within 30 calendar days, and this is from either the EOB or the letter date, depending on what type of denied claim it is. And of course, with AB 1455, it does specify that you have to give a specific reason for denying or contesting a claim, so that hasn't changed. The provider dispute timeliness is still 45 working days, so you can issue the determination letter within that time frame, so you're okay with that. There is a note that 3275 also applies the same timeliness with all claims, regardless whether they are clean, unclean, contracted, or non-contracted. So it's every single claim that we process. Next slide. So these claims for date of receipt on or after January 1st, 2026. So plans and the delegated entities must pay a rate of interest 15% per year. This rate has not changed. So we are okay with the original. We don't have to change anything with that. The interest amount is calculated based on the number of days past 30 calendar day deadline. So on the 31st calendar day, then you have to pay interest. And of course, failures to comply with the interest requirements will result in additional penalty payment equal to $15 or 10%, whichever is greater. So that is the one change. It used to be a flat $10 penalty. Now it's going to be $15 or 10%, whichever is greater. Below is the first one is an interest calculation example. It's just a normal example, which most of us already know. And then the penalty is a little bit different. So what you have to do is you have to find, so say you underpay the interest amount by $1. So you would base the penalty payment based on that extra dollar that you did. And if it's under $150 usually, then it's going to be the automatic $15 plus the dollar that you have to pay. Next slide.
Hi, excuse me. I have a
Yes.
question regarding the
Yes.
interest when it comes to the PDRs.
Yes.
So I'm still having trouble wrapping my head around this 30-day and having the 45 working day. Previously, under AB 1455, if we have a PDR, we overturn our original decision, and additional payment is due to an error on our part, we pay interest based from the receive date of the original claim. Now, under AB 3275, since interest is due for late payment at the 31st calendar day, is that, are we not going to go back to the original receive date? Or if that 31 day is only if we're paying, resolving the PDR past the 30 calendar days?
That is a very good question.
Leslie, can I
Our,
jump in?
oh, go ahead, Robin.
I was just gonna say, sorry. Deb, it would be, it's the same as it was before.
Mhm.
So if it was an error on your part, you need to go back to the date that all the information was there. We do that with every claim, whether it's an adjustment, a PDR, or whatever.
Mhm.
If you're going back and doing an adjustment or a PDR, and you have to go back to the date where you had all the information that you could pay the claim correctly. So if you have to go back to the original date, you still do that, and you're going to pay interest on that time frame. However, and I think Leslie might have an example later on, or we do in our FAQ, that will show you what happens when that original date, the date that you have everything, was in 2025, and when it was in 2026. So we've got an example for you on that.
Okay, so then where does the 31 day then comes in with the interest?
So you're still compliant at 45 working days. So when you process it, they're not going to say your PDR was late. You have 45 working days to do it. However, if you do overturn it, whether it's your fault or whether it's new information, you are tied to the 30 calendar date if you're looking at something that was received in 2026. So if it was something that was processed in January, you received it in January, and you have to go to use that first January date, you're going to pay interest after 30 calendar days. That's the rule. And like I said, we'll show an example and you'll see that. But if
Okay,
you're going back to something that you received in 2025, the old rates are applying because that receive date you're looking at is in 2025.
yeah, and yeah, but basically my question was based upon the new regulation. So,
Yes.
and I'm going based upon the PDR was received in 2026. Then that's where my question lies. Does it go back to the original receive date to calculate the interest, or does it start at day 31?
Yes, nothing changed with PDRs with the rules on how you process. You would go back to the original date.
Okay, so
Okay.
I'm sorry, I'm still having a hard time grasping
We'll-
that, but I'll mull
we'll
over
show
it a
an
little bit more.
example.
Yeah, and
Okay.
then also I do have one more question because I don't know if that's going to be in the slide. Also, when we need additional information to resolve a PDR that was received in 2026, did the regs, because I haven't seen anything, allow for additional days to resolve that PDR? Because, you know, like in AB 1455, if we needed additional information, we would pin the claim and request the additional information, and we had additional 30 working days to resolve that claim. Even if, say, we asked for the additional information on like the 45th day, working day, that we still got an additional 30 working days to resolve it. Is that there's something similar under the new regs under AB 3275?
Nothing in the new reg changed what you had in AB 1455. That still applies.
Okay, so then we would get
The
an
only thing that
additional.
changed was interest. Yeah.
Okay, so so we would get, so we wouldn't be penalized or wouldn't be cited for being late in resolving the PDR if we have to develop it and or append it and ask for additional information, we would still get the additional 30 working days.
The clock stops during that time frame, yes.
Okay. All right. Thank you.
Okay, so here is just an interest example. So the penalty, if interest was not paid when it should have been, or if it wasn't paid in full, so like if you underpaid the interest, it's $15 or 10% of the accrued interest, whichever is greater. So here's an example. The claim paid late and paid interest in the amount of $2.58. However, the calculation was not correct and it should have paid $3.58. So this is basically the dollar amount example that I provided before. So $15, 10% of the dollar amount. So that's only the dollar, the underpayment amount interest. So $15 would apply because it's not over $150. So normally if your additional interest owed is $150 or greater, then you're going to probably do the 10% of the accrued interest and not the $15, which will usually be more. Okay. Go ahead, next slide. So on a leap year, since we have calendar days, we have to use the 366 day as the denominator for the interest calculation formula. And HICE has been, I think we do have a completed interest calculator for Medi-Cal, commercial, and Medicare to include the leap year. Additional payments, overturn PDR. This is kind of what Robin was stating too. If the provider disputes the initial payment or underpayment, we overturn it, even if it wasn't our fault, if we got like additional information or anything, if you don't pay that claim within the 30 calendar day, interest automatically applies whether you're in error or not. And then just to reiterate, a complete claim typically means a claim that includes all the necessary documentation. It must be submitted in the format that complies with regulatory standards, which is the CMS 1500 or the UB04. It must include the prior authorization documentation if applicable, and it must contain defects or improprieties that prevent adjudication. If not, it must not contain, sorry. So most of us know that. Okay, next slide. So this is just a cute little chart that kind of shows from prior and before. Just, you can even give this out to your staff or whatever, kind of showing that the changes. So if you have a received date of before, you look to the left. If you have a received date of after, you look to the right. And as Robin says, it does get a little bit different when you are looking at adjustments and disputes, but this is basically timeframes of a new day claim that that have everything received on or after or on or prior to. So anything is based on the original receive date, and we'll have examples after that. With that said, now our next presenter is Robin. So.
Good afternoon, everybody. This is Robin Del Morales. I work at Kern Health Systems. I'm the Senior Claims Director. And I also co-chair the AB 3275 work group. So some of you who were at the conference may see some of the information again, but we use that as well as some other things to change it up a bit here today. So this slide, what I'm going to go over is more of suggestions for delegates and health plans to stay on top of inventories to help ensure compliance. So the first thing is having internal TATs. That way, if you have something, we know we have the 30 calendar days, but if you have your own internal TAT, that will help you be able to monitor it and make sure you don't miss the timeframes. For example, if you're doing weekly check runs like we do, we have an internal guideline of 22 days. That way we know if we're paying things at 22 days, that means we're definitely going to meet it for our check run and not have issues. If I'm not going to meet something, or if I'm monitoring and I see something's going to go outside that time frame, then we are contemplating having some extra check runs that we may do off cycle to make sure that nothing is out of compliance. So those are some things you might want to look at if you're struggling with meeting the 30 days at this point in time. Another thing is for claims reviewed by other departments. So when you have to send something to or you have to send something to provider relations, or maybe to your config department to have something updated in your system, you want to make sure that you're looking at those timeframes as well. If you in the past gave a different department, let's say 10 days to get an answer to you, well, that's a third of your time frame. So you might want to cut that back and say you only have 5 days. So those are things you need to negotiate with your other departments to make sure that they don't inhibit you from being compliant. If it's not meeting, then like I said, revisit it and improve that process. Another thing you might want to do is combination. So if you have to send something to the department and it also has to go to provider relations, is there a way that you can send it simultaneously so they can both work on it at the same time, as opposed to sending it to one, getting their response, and then sending it to another department? So try and look at those processes that you have internally with other departments, meet with them, and see how they can help you stay compliant with the 30 calendar days. Third-party vendors that you may have. Maybe you have someone who does your mailroom for you, or works, submits your claims, or sends your claims into your system, making them electronic. You might have, like I said, a 5-day turnaround time for them. You might want to consider changing that to 3 days, because again, the more time you give other areas, the less time you have in your claims department to work that claim. So we want to make sure that you're looking at all those aspects. Look at other areas to see, can you fine tune some of those time frames to make sure that you are compliant with your 30 calendar days. Focus on converting claims to electronic. If you haven't already, see how many providers have provider relations, or work with your provider relations to reach out to those different providers to see if how they can start sending the claims in electronic to you. You know, we have a over 99% electronic adoptance from our providers. So, but that's something that we worked at for quite a few years, making sure that our providers were trying to send it in an electronic format. So it definitely expedites your loading, and I don't have to have that 3-day turnaround time that I allow someone else to have to get that paper claim into my system. It's something that I get immediately. So look at possibility those options for you. Watch for your migrations and system upgrades, because a lot of times you get behind if something doesn't go well, or if there's an issue that they have to push it back, or if something doesn't work right, so now you have to have extra time to get your claims done. Maybe there's some manual processes you have to do until they fix something. Try and think of all those things ahead of time before you do those migrations, perhaps trying to get ahead initially. So maybe do some overtime before you do a migration, just to make sure that you've got yourself, about 10-day leeway, so that you don't have to worry about those 30 days on the claim. And then the last thing another thing would be, monitor daily and escalate. So if you find that your claims, you're hitting close to that day, again, that internal clock that you put on your claims, if you're going to hit that time frame, you might need to escalate. How can I get this so that does this review so I can get this claim out and paid within my 22 days or my 30 calendar days at the end of the check run? If you do a weekly check run, like I said, look for off cycles. Perhaps you can do some off cycles to make sure you get those stragglers, so that they don't hit out of compliance as well. And okay, I think next slide. So those are just some suggestions we had for ways to look and help improve or fine tune your internal turnaround time, so that you're not hitting up against the 30 calendar days trying to get it out a little bit beforehand, so you've got some breathing room. These are resources and references that we used in compiling this, as well as when the regulations first came out, the different things that we looked at as a group. that we thought maybe we would help you with. These are all links except for one of them. So of course, the Knox-Keene Act, you've got a link here for that. The claim settlement practices, that's in here. The provider dispute resolution, again, that's still the same. The only thing that changed was the interest. So you still have that there. And then the one that is not a link is the 1371 to the 137135. So claims prior to 1/1/26, that still falls under the 1371 regulation. And then the 1371.35 is the updated portion of the California Health and Safety Code that shows for claims received after 1/1/26. And then, of course, the publication that we have is the APL 25007. Reminder, this is a DMHC APL, so it applies to commercial as well as Medi-Cal. Okay, and then I think we're up for some questions and answers. But before we start on that, I did want to say that we didn't talk about reporting here. And reporting, hopefully everyone has done their first reporting where we had the double 25 and 26. We did publish a tool, so hopefully people were able to use that to help them identify what it is you needed to put into the new portal or into the portal for DMHC. Because they didn't have separate line items for 25 and 26. It was a combination that you were supposed to put in there. So hopefully you were able to use that. If you have any questions, we can talk about that today as well. And then we are starting at FAQ. So any of the questions that you come up with today, we will be adding it to the FAQ and going through and publishing that as well. In the conference, we did have some examples that we had gone through, different types of examples that we have added to the FAQ to get it started. So I am going to try and share. So I'm going to take the screen with oh, I don't know what I'm sharing. Hang on a second here. There. Can everyone see the start of the FAQ?
Yes.
Okay, great, thanks. So the first one is, and hopefully, Deb, this will answer, hopefully I'll get your question answered in here as well. If not, we can add that example and get that added to the FAQ. So the original claim scenario, original claim was received on 12/30/2025, and it was paid on 2/15/26. The rule here that would apply would be the 2025 rule, the 1371. So we would be working with 45 working days because the claim was received, the full claim of everything to process was received in 2025. So this one would have been paid at the 45 working days, and it was under 45 working days, so no interest would apply. Same scenario, same claim, but it was received in January instead of December. So now this falls under the new regulation 1371.35, and since it was paid on 2/15/25, it was actually late, so interest would apply. And we would be paying interest on the same claim, but because it was received just a couple days later, it falls under the new regulation. If it was an ER claim, so we have an ER claim received in December of 25, paid in February of 26. Again, the 45 working day rule applies because we're looking at the receive date of the complete claim. When did we have all the information so that we could pay the claim? It was December of 25, so the 1371 regulation applies the 45 working days. Had this been late, we would have had to pay the ER interest at the $15 or 15% because that was the rule in 2025. The same claim received in January of 26, we would follow the 1371.35. This was late, so we would pay interest at 15%, not the $15 or 15%, but the 15% only because this is in 2026, and that's the new regulation. Okay. Going on just to some adjusted. So on an adjusted claim, the original claim, hopefully I spelled that right. Original claim was received in November of 25, and it was paid in November. And then a corrected claim was received with new information on January of 26 and paid in February. So on this example, because the complete corrected claim, new information was received in 26, the 30 calendar day rule applies. So it's now 2026 rules, and therefore this was paid at 36 days, so interest applies. Same scenario. The claim was received the original claim was in November, it was paid, and it was determined to be an error. It wasn't new information that was received, but we found there was an error in how it was processed, and we owed an additional $20 to be paid. So this claim needs to be reprocessed and pay the additional $20, and we go back to the original receive date. So because the date the full claim was received was in 2025, the 2025 rules apply. And therefore, we would pay this based on the timeliness of the 2025 rules. We would pay the 45 working days. And since this claim would have been non-compliant, I think if I count the dates, yes, because we're using November. And interest would apply beginning on 1/17/26. Adjustment of an adjustment scenario. So here we have an original claim was received in October of 25, and we paid it in November of 25. An error in processing was discovered in January in 2026. We reprocessed using the original receive date of 10/30/25, and we paid the additional $20 on 1/15. And we paid interest on that because of the time frame on January 8th. But on 1/20, we realized, oh, there was another problem. We should have paid $30, not $20. So we still owed $10. So on January 31st, we paid the additional $10. Additional interest on the $10 is owed beginning January 8th, as well as the $10 penalty for not paying interest on 1/15/26. We're using the $10 penalty and not the $15 penalty because the rules that we're applying to this claim are 1371 because the original receive date that we had to go back to was in 2025. And then the next example, another adjustment of an adjustment, but now we're using original receive date in 2026. So all the 2026 rules are going to apply. We would use the 30 calendar days. Interest would apply at day 31. If we didn't pay it, again, we had the additional $10 we had to pay. We would go ahead and pay that $10, the additional interest owed on that $10. And then the penalty in this case would have been $15 because it was using the 1371/35 rule because the claim was received, the complete claim was received in 2026. So hopefully everyone is seeing the mantra is when was the complete claim received, and that's the rule that you use, which rule you're using. That kind of helps you break it out as to when do I use the old rules and when do I use the new rules. You're looking at when you're processing the claim, what is the receive date you're using for that claim? If you're going back to the old one, you're using the old rules. And then a PDR scenario, the original claim was received and processed correctly in 2025 based on information available at the time. In 2026, a provider dispute was received with new information, resulting in an overturned determination. In this scenario, the claim is overturned and paid on the 44th working day, which is within the regulated time frame for the PDR and not considered late. However, given that the overturn is based on the newly submitted information in 2026, the interest is expected to be calculated beginning the 31st calendar day. So interest begins the 31st calendar day. The complete claim was received in 2026. Therefore, the 2026 timeliness rules apply to the claim. But in your reporting of PDRs, it was a compliant PDR. Just a few more on PDRs. So we have another PDR dispute was received and overturned due to new information in 2026. Complete claim information was received in 2026, so the timeliness is still 45 working days, but interest applies on the 31st day, just like the other example that we looked at. PDR scenario disputes received and overturned due to incorrect processing of the original claim in 2025. Again, original receive date drives what you're using. So this is 45 working days and uses the time frame of interest at the 45 working days because it's using 1371. And lastly, the last PDR scenario, dispute was received and overturned due to incorrect processing of a claim in 2026. Because everything is related to 2026, the 30 calendar days for interest applies, but it's still considered compliant if the PDR is completed within 45 working days. Okay, so that's the start of the FAQs. And Rebecca, I think now I turn it over to you if anyone has any questions.
Did you catch the question that was in the chat?
I did not. So let's see about the presentation. Oh,
If everyone's system allows for 2 different interest calculations?
Oh, so that's a question we can send out and maybe do a do a little not everyone's system allows for 2 different interest calculations. I know that what we had to do, and I can only speak for my system. What we had to do was actually come up with a script that we would do 2 separate check runs based on the receipt date of the claim. So we would run all the claims with receipt date of 2025 using the old interest rate. And then once that was done, we would run a script to change the interest rate in the system and run the 2026 claims against that. I don't know how anyone else did theirs. Some systems, I do know a few systems that people have told me they are able to do 2 separate interests. I know my system is, company is trying to work on it, but for now, that was our workaround. If that helps at all.
And I think for Sutter Health, we could not. So of course, we're defaulting to the 30 calendar day, which will, if you overpay interest, that's fine. So, I don't think our system can do it.
Yeah, for us, fortunately, we're below 30 days. So if there's any claims in 2025, we're changing the interest during that, like one of our check runs, and making sure that all of the claims for the 2025 fall within that check run. So the correct interest could be paid. And then we change our interest back after that check run, but we're only doing it once a month.
Hi, my name is Brad Goodpasture with MedPoint Management. I was wondering if I could ask a question about I'm having a little confusion on, I'm posting it in the chat right now, and it's the 15% error, and then it also turns to 15% or $15 or 10% of accrued interest. Maybe I'm a little confused. It sounds like it's double stacking. I was trying to understand it when I was looking at your the graphic that you said was a great graphic, because it said it was like 15%, but I remember seeing something about this 10, so I'm a little confused.
Sure. So the 15% is the interest rate, right? That's the interest you pay if your claim is late. The $15 or 10% is a penalty. So that's the penalty you pay if interest was not paid when it should have been.
Okay.
Like today that is a flat $10. The penalty is $10 today, or was in 2025. But in 2026, they changed that to be $15 or 10% of the accrued interest, whichever is greater.
Gotcha. So that would stack then? So there'd be a 15%, that would be charged, then plus another 15%, $15 or 10% additional. So it'd be like 25 25%?
If the interest was paid late.
Okay. Okay, thank you so much. I appreciate it.
Okay.
Yeah, or if the interest was underpaid or not paid, then the penalty only applies. But if you paid interest when it was late, then you don't need to pay the penalty.
Thank you for that clarification.
Okay, shouldn't the I'm sorry, I'm just reading from the chat. Shouldn't the penalty also apply if the interest was not paid accurately at the time it was due? Yes, absolutely. So that is that's what Leslie was just saying. So if you didn't pay interest when interest was due, or if it was not paid correctly, then the penalty would apply. Is it a Kenya?
Ikenia, yeah,
Ikenia,
Ikenia
thank you.
Williams.
Thanks for correcting me.
Yeah. Oh, no problem. Ikenia Williams, claims in Kaiser Permanente. I don't believe this was a change, but we're seeking additional clarification, obviously, because this time frame is cut in half, and so it really is impacting scenarios when we have to request additional information. And I joined a few minutes late, but was that discussed a time frame for request for information and what interest would apply? So my question is, if we requested the information after day 30, essentially, I don't want to call it contesting a claim, but we're requesting additional information in order to remit payment, but we didn't do that until after day 30. When we receive the information back, is interest due from the moment we receive the information back or back to the original time frame because the request was actually late?
Yeah, that's actually a very good question, but I want to clarify a couple things. So when you say that you're in essence developing the claim, this doesn't apply
Yes.
to Medicare line of business. This
No.
only applies to commercial. So just wanted to make sure that you're not talking about the Medicare development.
No.
So on a claim today, well, in 2025, what would you have done?
The interesting thing is, we didn't make a change there. So we would have, but I don't know if this is right, which is why I'm like, let me just make sure. It wasn't that much of a concern in 2025 because we never did it past 45 days, but
Okay,
our system would have calculated it back
got it.
to the original because it was beyond the 45 days. Now that we're at 45 business days, now that we're at 30 days, we are actually seeing some impact. So we're in essence questioning ourselves, right? Like,
Yeah.
is that the right thing to do?
Well, according to what we've read, it does say that it's, and I think, Julissa, I think you had it on one of your slides, that it's, it doesn't matter, it's not a clean or unclean claim anymore. The regulation simply says all claims. So I would say it's to the 30 days and then you have to, it should have been paid by the 30th day.
Or contest it or whatever,
Yeah.
right?
Yeah.
And then so
Now
the
we can
interest
get that
calculation.
clarified too, but yeah, that's what I would think, but that's something we could get clarified.
Yeah, that would be helpful because the other piece of that and that we're contemplating is how much time do we give providers to get us that additional information, right? There
Right.
wasn't any specificity in any of the regulations and say you have to give providers, this number of days. And so if we're going to accrue interest through all of that time, we may need to reduce the amount of time that we give providers to get that
Right.
information back to us. So
Yeah.
that's really where we are right now. So if we can get that clarification, that would be great.
Yeah, and
I
I know that that was one of the things when the first APL came out, or when AB 3275 came out and they asked for feedback, that was one of the pushbacks from a lot of the groups. You know, the California Association of Health Plans and California Association of Provider Groups. They a lot of the pushback they provided was that we would no longer be able to develop these claims for providers or give a provider opportunity to send something in before it got denied. So really telling them that you're kind of cutting our feet at that point, saying we have to make a decision and that's it. So it may be the way I'm thinking, but we absolutely will get clarification, just because I don't want to say it's just what I'm thinking. I think we should get clarification from DMHC.
Yeah.
And
Yeah,
Leslie,
because
I'm
it
sorry
will
I
it will
stopped you.
impact our process, because we may
Yeah.
make the decision to not develop it, not, I mean, to actually just deny, right? Rather than request the
Mhm.
additional information.
Yeah.
Okay.
And it's cut in more than half. Half would have been 32 days, so.
Right. More than half.
And I'm sorry, Leslie, were you gonna talk and I kind of started?
Yeah, no worries. I was just trying to get clarification. If you're trying to request additional information and you're trying to get to the provider, but you have to ultimately deny it within the 30 calendar days, and then they submit the additional information, interest wouldn't be due because you still have a time frame to deny the claim or contest it. You're basically contesting it.
Yeah. It sounds
So
like
I
they don't
just,
contest, that they send a development, that's why.
okay.
But yeah, I agree.
I would agree that you would not have to pay interest even if you have to, ask for additional information and have to deny it or contest it. Okay.
Well, wait, say that part again. Who was
If you
that?
do not, if you contest the claim, it was Leslie. Go ahead, Leslie.
Yeah, so if you ultimately need, you're developing the claim, but you ultimately, because you're bound by a time frame, you don't have to develop it, especially, for commercial. You can just ask for the, deny it, requesting the additional information, so it's a contested claim. And then once they give it back, you did contest the claim correctly. You're asking for the additional information, so no interest would be due.
But in that instance, so that would be changing some of our business process, because we're not denying those right now.
Are you leaving them pended?
Yeah.
Okay, so that's different. So you'll just be non-compliant on the timeliness for that claim. And if you end up paying it, then yes, you will have to pay the interest.
Hmm.
So you're not
Yeah,
closing out the claim. Okay, you're not closing out the claim.
yeah,
Okay.
these are the I mean, we didn't have to fully flesh this out before, but now we see the impact. So the question is, do we deny?
If you leave the claim open, then you're subject to having to pay all that interest.
Yep.
It doesn't
That's
specify that. So that's why, like a lot of claim shops, like Sutter does, is that we will contest the claim for the additional information. And then once they, receive it back, we will either submit it as a new claim or adjust the original claim, but no interest is applied.
Yeah, and then you're adjusting it, and you're applying interest only if it takes you more than 30 days to finalize that adjustment, right?
Yes, exactly.
Hmm. Okay. That's a consideration. Thanks for the discussion. And if there's any additional clarification, feel free to forward it over to us, but we'll take some of that into consideration.
Any other questions? Am I missing anything in the chat, Rebecca? Or any hands up?
I have a
I
question.
don't see anything.
I heard somebody.
I have a question. Similar to the lady earlier, in PDR, when we request additional information, we technically don't adjust the claim until we get the information we're getting. We're not closing the current PDR that we have. that is past the 30-day turnaround for the AB 3275. So when we request additional information that go beyond the 30-day turnaround, that is our question. Do we have to pay penalty for that because we not back out the claim at all because we just leave it the original status and request for more information when we did not get that the information on the provider disputes that they submitted to us?
Right. So penalty wouldn't apply because penalty only applies if interest wasn't paid or wasn't paid correctly. And what you're talking about is like
Interest.
Deborah had is interest, right?
Yeah,
So
yes.
do you have interest? When does interest start in that scenario? I have to go back and look at the regulation because I don't know. So we'll do a follow-up and make sure that's on the FAQ for everyone.
Okay.
And
Thank
this
you.
is specifically asking when you're asking for additional information, right?
Yeah, so on the
Yeah,
PDR,
I'm
when you
not
send
quite
out
sure
that
either.
letter that says, you know, we need
Yeah.
additional information, do this, and so we acknowledge it, but you need to send me more information. And usually the
Yeah.
clock is kind of stopped at that point, so the question is how do we do that one? I don't know.
Yeah, that's a good question.
Yeah, as far as my understanding is that all the regulations for PDR stayed the same, except for the interest. So that's what so I have to go back to the old one to look it up. I don't know.
Thank you.
Hey, Matt, what's going on?
Hey, just quick question, just curious how other people are handling this. So at Health Plan of San Mateo, we've got, PDRs are still on the same timeline. They're staying with 45 business days, but our providers may use the PDR process to correct a claim, right? So we'd be able to age it back to the correction date, and that claim would be held to the 30-day requirement, right? But our PDR workflow is managed at 45 days, and until you review the PDR, you don't necessarily know, right, that the claim may become clean and be subject to the 30-day for interest purposes.
Mhm.
Hope I'm making sense. I'm
Yeah.
curious, like how others are managing that specifically, given it usually requires you to review the documentation to know what the situation is.
Yeah, I could tell you what we do. And basically, so we're not allowing providers to use the dispute process as sending it. If we've requested additional information and now they're sending it in, we have a policy and we have there's a provider bulletin that we sent out telling them how to submit a corrected claim. So they shouldn't be sending it through PDRs. We tell them PDRs, there's a lot of things you have to do, you have to acknowledge, you have to do all these things, and it takes a long time, where if you send in the corrected information the way we told you to, it gets paid in 10 days. So usually they do it as a corrected claim and stop sending it as a dispute.
And this
But
is
I don't know if
Lisa.
anyone else, go ahead,
Yeah.
Elisa.
Yeah, this is Lisa from Sutter. We're doing the same as you guys, Robin. We do not accept additional information through our PDR process. We do also, well, I shouldn't say push, but we encourage our providers to submit corrected claims, electronically using the correct frequency code. So that way, no manual intervention is required unless it has the pen for, like an example, auth require or some other pens, and then that automatically adjusts the claim. We use
Yeah.
Epic, so it automatically adjusts the claim and then backs it out. And then if it qualifies for auto adjudication, it goes out the door. But if there's other pens that require manual, then of course my processors will be reviewing and processing the claim as a new day claim. Leslie,
Lisa.
anything?
Appreciate-
Yeah, Leslie, anything to add on that?
Nope, you
Yeah.
said that. What we do is so even if they submit like a provider dispute form, if the claim was processed correctly the first time and they submitted additional information, we will not process it as a dispute.
Correct, that's true too. Yes, thank you for adding that.
Hi, it's Sandra from Santa Clara Valley Health Plan. Yes, we do the same at the intake level. We would just send that back to claims and not treat it as a PDR. We also do, I do reports for high dollar cases. Like for example, if we have like a facility list of facility claims, well, disputes. I know it's based on billed charges, but it kind of gives you an idea whether or not if they're, if they're going to be inpatient, we will go ahead and work those first because we don't know if the claim was processed correctly until we, analyze the claim and, at the PDR level, we go ahead and work the high dollars first, and then we work our way down. I know it's out of order as far as date receipts, because we normally, if it does need interest, we catch it right away.
Great. I really appreciate the feedback. Yeah, we've got correction options available as well. So yeah, I think that's a good idea. We'll just kind of reiterate and try to continue to emphasize the benefits of our options. Thank you.
All right, thanks, Matt. Anyone else have any other questions?
I would like to just share a little bit on how we accomplished our 30 days. Not sure if some organizations or health plans are struggling or not. This is Lisa again from Sutter. Interesting enough, about a year ago, that was an internal goal that we had, was to reduce our inventory by 30 calendar days. And little did we know that this regulation was going to come into play. So it really, I think the major changes for us was the programming, if it was able to be programmed, but it also gave us an opportunity to look at our auto adjudication in general, right? What percentage are we auto adjudicating? I'm glad to report that we are at trickling between 92 and 95% of our claims that come in auto adjudicate, but then working with our other internal business partners like our department, looking to see, thank you, I see some clapping there, looking to see if there was opportunities to look at our auth requirements. I mean, we've done great work around that. Also network contracting to see if we're able to change thresholds on claims that require LOAs, and looking at other business operations in general. And so not only our new day claims are being paid within, well, a little less, I should say, but I think we're trickling somewhere around 25 days on our new day claims. And I can proudly say that our PDRs are actually done also under 30 days. So we're not even paying interest on that. So I don't know, Leslie, you do the reporting for our organization, but for the most part, we are doing fairly well.
Yes, and I would say that the bulk of our PDRs are upheld, so the overturns are very few, and the processors have done a great job on getting those under 30 days.
Great. Thank you, guys. Thanks for the additional feedback. And I know we're at time, so thank you all for joining us. We really appreciate it. And hopefully this helped a little bit in jogging some ideas or something that you can do to help your area be compliant with the regulation. If there are additional questions you come up with, please send them to Ricky. Ricky, I'm going to put you on the spot. Send them to Ricky and she will get them to us so that we can add it to the FAQ and get us answers. I will work with my co-leads to try and clean up this FAQ that I started and hopefully get this published for you guys in the next month or so. But thank you, everybody. Thank you, Rebecca, for putting this all together for us. We truly appreciate it. Anything else? You guys have a great weekend. Have a great week, rest of the week and weekend. So